I didn't use my insurance when I was in my early 20s. I have some health issues now because I didn't get them looked at sooner. And I feel like if I had that confidence to be able to ask those questions a lot sooner, I wouldn't be in certain positions that I am now.
Welcome to Under the Coverage,
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people. Kyla has been working in the health benefits industry for around 3 years, and it's enough intensive training to teach you a thing or two about benefits. Kyla is highly regarded as a dependable team member. She has accolades for delivering great customer service, and we're lucky to have her with us. Before we met with you today, you mentioned that you wished they taught this in high school and in college, and I think that's a brilliant idea. People would probably dread going to class, but I think it really is a life skill that we are all fortunate to have because of what we've learned working in this industry.
Thank you for joining us, Kyla.
Yeah, thank you guys for having me. I'm so excited about this.
We're excited too. So we invited you to join us today to talk about advocating for yourself as a healthcare consumer. Before this episode, you shared that since you started working in the health insurance industry, you gained confidence, which has helped you to start asking more questions. So let's dive in. How do you think you advocate for yourself now?
Yeah, so I think what I was really going back behind that statement is when it comes to like my own health insurance and my own choosing of different types of insurance, especially when it comes to that open enrollment time period, I still don't know it all, but I have gained a little bit more insight to be able to be like, oh, this is what I really truly need to advocate for myself. And this is what I need in a plan. And then also when it comes to like my doctors and everything, I advocate for myself in stating that this really doesn't go with what my insurance is covering. Are there ways that we can go around this? Are there things that we can do? And I definitely think working in this industry has, helped me gain that confidence and that ability to advocate a little bit more.
So can I ask, and you don't have to like give away CPT codes or anything, but what is an instance maybe where you were talking to your doctor and you said, is there something that kind of aligns better with my insurance?
There were a couple of times where the medications that I was using just didn't fit with what the insurance was covering and just didn't fit price points. And it really helped me be able to give my insurance a call up, be like, hey, can I have these options to give to my provider and say, hey, can we start here with those? And that's really one really big instance that happened for me.
That's interesting because I went to a dermatologist not long ago and they were talking about this fantastic medication that's newer, which sent bells off in my head. And it works great for everybody. So they wanted me to try it. And question came out of my mouth that I know 10 years ago I never would have asked. And I said, is that a tier 1 drug?
Yeah.
Because I know, first of all, I'm in a high deductible plan. So I know the full cost of that drug is coming out of my, like, that's all me. So they gave me a copay offset card and then they told me to check out GoodRx as an option to maybe save some money on the prescription, depending on where I chose to get it filled. So, but it is a question. Otherwise, I might have just accepted the prescription and gone to the grocery store to pick it up from pharmacy and dropped dead at the final cost.
That's what happened to me is I was, I'm on the high deductible plan and I had some expenses that had brought down that I'd used up my deductible. And so when I had used up my deductible, I was on this medication. I was on Latuda. And as soon as January 1st hit, I went to go fill my script and it was like $1,400. And I was like, I'm sorry, I have insurance. Why is it so high? And they're like, oh, that's because you haven't met your deductible. So I was just like, oh my God, tears aside, but
right.
It was one of those moments. Yeah.
Another question, what kind of questions do you ask your insurance company now?
I really ask about, I suffer from lymphedema, so a lot of it has to do with asking about different treatments that might be in my coverage. Different things like I go see. I was seeing a physical therapist for lymphedema for a while, so that was one of the things that I was like, is this something that I'd be covered for? Because like this is a really big treatment that would help me with it. So just little things like that, like are there little treatments that I can find?
It's probably not a service that people would necessarily associate with being able to ask the insurance company to help understand what options are available to you and then how that cost might fit into your lifestyle or benefit plan. So that's
Yeah,
good to know.
yeah, it was one of those things where I was searching myself and was recommended physical therapy. And it's like, I've never thought physical therapy for lymphedema before. Like, this is something totally new. So, like, I went and I like called my insurance and I was like, hey, like, I understand physical therapy might be a covered benefit, but like, is it, if I have it specifically for lymphedema, is that going to be like a separate benefit? Is it going to be a separate charge? Because I know in our groups, for some of our programs, it's separate types of coverage benefits. So that was one of those things that kind of keyed me in while I was working here. It was like, hey, is it going to change?
So on the flip side, what do you ask providers now that you might not have asked previously, kind of knowing how the insurance world works? You know, when you're sitting in the doctor's office, is there something that you would ask differently that you wouldn't have before?
Yeah, definitely. I would, I pay more attention to covered services versus non-covered services. If it's definitely something that seems a little out there, I'm like, hey, is this something that's going to be experimental or is this going to be something that's a covered service for me? And like and especially with like lymphedema and everything, there's not a lot of sciences out there. Like it's still being explored and it's not a very highly served community. And so there's different things that like I'd have to go to different providers, do different things. I need to figure out, is this going to actually be covered for me in the long run? If that makes sense.
It does.
100%.
As we mentioned in your bio, you know, you said you wish that they taught this stuff in high school. And you know, seniors, they've got a lot of study halls. So why not fill it with a class on health insurance and how to kind of navigate the system, right? I just loved that you pointed that out, and I think that's such a great idea. So you should submit that to the feds and the state government and see what they say.
Yeah, I would love it. I would love if we took our health insurance, like our health care, and actually prioritized it to younger people because a lot of younger people don't know. Like I, coming from myself, I'm 27 years old. I didn't know much about the health insurance world until I started this job. And what I learned in this job was mind blowing to me. So like I wish that like I had had this like little boost to myself for college or high school, even if it was like half a semester, you know, or half a year class in high school. I was like, this would have been so much helpful.
Yeah. When you think about what you know now versus what you knew or how the questions you might have asked or how you thought about your benefits, if at all, before you started working in the industry, I feel like it's kind of night and day. And I think it
Yeah.
makes us better consumers. And the way healthcare seems to be moving, it seems to be moving in a place where more people would benefit if they had kind of the training and education that helps you become a consumer, just like when you're going on vacation or when you're researching whether or not you
Yeah.
should buy those outdoor solar lights or a new pair of shoes. How do you make a decision or ask questions if you don't know what questions to ask?
I didn't use my insurance when I was in my early 20s. I was on my parents' insurance and I, you know, have some health issues now because I didn't get them looked at sooner. And I feel like if I had that confidence to be able to ask those questions a lot sooner, I wouldn't be in certain positions that I am now. So, you know, I definitely feel that it's one of those things that I wish younger people took more time to care about it, as well as we tried to prioritize it for them.
Had I known I was going to market self-funded insurance, my conversations with my guidance counselor in high school would have been quite different, right? So 18-year-old Jolene having those conversations. Hey, maybe after taking a class on how to navigate that system, it would inspire some people to get into the industry, right?
Yeah.
It's important stuff, and we appreciate you being on here to shed some light on it. And thank you for what you do. I know you talk to people all day long and help them navigate the industry and kind of, what would best fit their needs. And we're thankful for that. So thank you for all you do.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR-the-coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.